Hello, everyone. I'm delighted to welcome everybody to the first episode of my mentorship series. My name is Professor Emmanuel, and I'm an infectious disease physician and a professor of medicine at the Niger Delta University and the Niger Delta University Teaching Hospital in Bayelsa, Nigeria. I'm very excited to introduce the first episode of my mentorship series, and I'll be discussing the secrets to passing any examination with bonus tips for medical students and young doctors. So let me tell us a story about Emmanuel. Emmanuel is a young Nigerian undergraduate of one of Nigerian universities who has just recently been admitted into the university. He intends to be a scientist after completing his education, and he wants to fit into the university system where he has opportunity to learn. He believes he will learn. Well, he's optimistic that he will pass his exams. So Emmanuel is of the habit of attending his classes periodically. What was important to him was to fulfill the requirements for attendance. So on occasions, he always asks his fellow students to sign the attendance register on his behalf. Examination is approaching. Examination about 10 days away, and Emmanuel is now study, has gathered all the resources, class notes from his colleagues, from textbooks and other sources, and is reading a lot. He's reading and rereading in order to pass his exams. The exam day has come, and Emmanuel is writing his exams, but during the course of writing, he developed thought block. He could not concentrate. On account of that, he had forgotten most of the things he read, and he could not answer many of the questions that were asked. Ultimately, Emmanuel failed his exams, and he was worried that he failed his exams. He wanted to know why, and he wanted to know how to improve and how to learn how to pass his exam. Unfortunately, many of us pass through school, primary school, secondary school, and even university without being taught how to learn and how to pass our exams. As a form of introduction, a number of articles have been written regarding academic success, learning, and memory. In PubMed, for instance, over 35,000 articles have been written, even before 1924 up to date. Several evidence-based articles have been written regarding what we need to do and how we need to learn properly for us to pass exams. There are also over 1,000 books that have been written regarding academic success and how to pass exams excellently and how to do well in life. Some of these books I've had the opportunity to read. So what I'm going to be doing in this series is to give us some tips, some secrets that I've garnered from my study of some of these research articles and some of these books that will help us accelerate the process of passing any examination. So if we have to learn how to pass any exam, we need to understand the learning organ in the human body. Of course, the learning organ in the human body is the human brain. The human brain consists of various parts, and in this figure here, I've just illustrated the various parts of the human brain and the several functions that these parts undertake. Not all of the human brain is involved in learning, and this second figure gives us an overview of the major parts of the human brain that is involved in learning, and that tells us that different parts of the human brain is actually involved in learning. So the next question we ask ourselves is, how does the human brain learn? I've just given us an overview. This picture depicts the structure of the human brain. Human brain must learn from an input, signals, and these signals usually come from our senses, our eyes for vision, our ears for hearing, our tongue for tasting, our hand for touching, and our nostrils for smelling. So we receive signals from all our senses, and these signals get to our human brain and they are stored as sensory buffers. Sensory buffers actually are information storage mechanism that lasts just for a few seconds, and we lose that information after a few seconds. If we pay attention, then we have a tendency of renewing that information that is stored in our sensory buffers. For instance, if you take a snapshot look at your television set and you remove your eyes, that information is stored in your sensory buffers. But when you pay attention, the tendency is that you encode that information, and the information goes to what we call your short-term memory. From your short-term memory to your working memory. And your short-term memory, you tend to retain information for a few minutes before that information is lost. But what you require to store the information in a repeated fashion in your short-term memory is to rehearse that information repeatedly. And that way you can store it for a longer period in your short-term memory. From your short-term memory, your information, every information you gather is consolidated into a long-term memory. I describe the long-term memory as a box of different stones with different sizes, reflecting the level of maturity of the information or your memory stored in your long-term memory. So the bigger stones represent very matured memory that are stored for a long time, whereas the smaller stones represent immature, nascent memory that perhaps are not stored for a long time and could be easily lost. So the process of consolidation is the process in which we make our memory to be more matured and to be stored for a longer time in our long-term memory. But when we also retrieve information from our long-term memory, it also facilitates consolidation. Actually, for every activity we undertake that is stored in a long-term memory, we retrieve it, it goes to the short-term memory and to our working memory before we perform that activity. It's also important for me to emphasize the role of emotions and meaning. Emotions and meaning has a significant role in influencing how we learn. Emotions stimulate our encoding of sensory buffers to short-term memory. Emotions also improve our consolidation. It makes our memory mature faster and better. So we also need to know that overall, consolidation of memory in a long-term memory is determined by retrieval, emotions, and of course, using multiple senses. Information in long-term memory can be lost, especially when it's not very mature, but it can also remain for a long time. And there are several things that we need to do to ensure our memory remains for a long time and we're able to retrieve that information to our short-term memory and perform the activity that we ought to perform, especially passing every examination. So I want to also give us some evidence of Ebbinghaus curve of forgetting, which is a groundbreaking research done by a German psychologist called Hermann Ebbinghaus, who created the curve in 1885. In this curve, he looked at the time it took for us to forget any information we have acquired in over some time. And what you observe is that every new information we acquire, within 1 hour of acquiring that information, we lose 40 to 6%, 60% of that information. And within 24 hours, we have lost about 70% of that information. And within a week, we have lost about 90%. So essentially, the Ebbinghaus curve says that if we do not make any attempt to retain information, anything we learn, we are likely to lose 50% or forget 50% of that information within 1 hour, which is actually very remarkable. It's also good to emphasize the role of Bloom's taxonomy and learning domain. Bloom's was in charge of an educational committee that looked at how to improve the learning experience and cognitive domains of our educational institution. And he came up with this taxonomy that was subsequently reviewed in 2003. They also discuss our so-called learning domains, which says that we learn either using psychomotor skills, our manual or physical skills, our affective skills, or cognitive skills, which include mental skills and our knowledge. The Bloom's taxonomy says that we have different hierarchical stages of learning, from the remote elementary learning by remembering and understanding to the advanced learning by creating, which says that we're more likely to have learned if we are able to use the information that we have learned to create something new. But the most rudimentary level of learning is remembering and understanding. And our educational system should be fashioned in such a way that we learn using the Bloom's taxonomy, we teach using the Bloom's taxonomy, and we assess students using the Bloom's taxonomy. And this Bloom's taxonomy and learning domain is very important if we need to understand the secrets of passing any examination. So it's important to emphasize what is academic success. There's very definition of academic success, but broadly it could be defined as the achievement of desired academic goals. So there may be several academic goals and depends on institutions and individuals, but the most important academic goal that will be a measure for academic success is passing any examination. Indeed, it is perhaps the only institutionally recognized academic goal, which is you have to pass your exam before you make any progress. So what are the predictors of academic success? What does the literature, what does the evidence say about what predicts, what determines academic success? Of course, there are several variables, but three variables stand out in determining academic success across several studies, and this includes self-constructs. That is your self-ability and self-concept and several things about you. It includes intelligence, your ability to reason, to solve problems, to understand. It also includes your diligence, that is efforts, your hard work, what you apply to your learning. These are the three most important factors that have been recognized as the most important determinants or predictors of academic success. Of course, there are other variables, and they include your learning strategy. The socioeconomic status is very important. Your study habits, your personality traits, your parental factor, and teaching methods. So today we're going to be discussing self-construct, intelligence, diligence, study habits, and the learning strategy. The road to academic success, of course, involves several activities and several attributes. And I've just given an outline that in your road or journey to academic success, you go through lectures, you read, you practice, you write the exams, and you receive grades. And you require several attributes. And some of these attributes we're going to discuss during these presentations. So, Emmanuel, what must change? I've just given us a narrative about Emmanuel, that undergraduate student of chemistry who has just recently failed his exam. So what must he change? He must change his intelligence. Of course, it is possible to change your intelligence. Intelligence is largely hereditary, but because our brain learns, and there's a process by which our brain learns, our brain is very flexible and very malleable, and we can teach our brains to be intelligent, just where we have taught equipments, machines to be intelligent through artificial intelligence. So we have the capacity to learn how to reason, to learn how to solve problems, and to learn how to learn, which is intelligence. So Emmanuel must learn how to be intelligent. Emmanuel has to change his mindset because your self-construct is very, very important in learning and also in academic success. Emmanuel has to change his study habits. Study habits are a significant contributor to academic success, and I will explain further in this talk. Of course, Emmanuel needs to acquire more skills related to examination writing. And examination writing is a critical aspect. You could be intelligent, you could have a good mindset, you could have good study habits. If you don't have good examination writing skills, you're likely to fail an exam. So what are the secrets to passing any examination? Secret number one is secret of you. A secret of you is perhaps to me the most important secret, and the secret that defines every other secret. This secret is so important that if we don't apply the secret, it becomes difficult for us to apply every other secret. What is the secret of you? Grit, academic construct, self-confidence, curiosity. Grit is about determination and passion and interest in what you are doing. Academic construct is about your zeal to do well in your academics. Self-confidence, you're self-confident in your ability to learn, to know, to do what is right, and to make progress. Curiosity is your imaginations, your inquisitiveness, your ability to learn something new. All these variables have been shown to determine academic performance by several studies. But one will ask the question, how do I improve my grades? I may not be naturally self-confident or curious. How do I improve my determination, my passion, and my interest? Of course, it's very important because this secret is very important. So what is advised even from study is that you look for small wins. Where have you made progress? Those small wins are likely to inspire you and motivate you to do better. Failure, too, is also a motivating factor. There are several examples of people, historical examples of people that have failed, and on account of the failure, it has been a motivating factor for them to do better. You also need to look at a driving force, a value, and a benefit in what you are doing. Passing your exams or doing well in your academics may be of value to you because it's a road, it's a path to a career choice. It's a path for you to study in a certain university or get a certain job. So as much as possible, in being determined, in being passionate, you look for value. And you look for inspiration from your colleagues that have done well, inspiration from your seniors, inspiration from your teachers. When you get inspiration will also put you at a platform where you apply grit and determination to do better. So this is the secret of you, which is, I believe, is the most important secret that is necessary to achieve every other secret. Secret of academic targets. There are several quotations by different authorities about the importance of having a target or having a goal. For instance, L. Nightingale, which is a media personality, says that people with goals succeed because they know where they are going. And there's a book by Stephen Covey which talks about 7 habits of highly effective people. And what he says is begin with the end in mind. So everything you are doing, have a goal, have a target. What's the benefit of having a target? Of course, several studies have shown that students that have academic targets tend to do better. It's because it helps you to stay focused, helps you to stay motivated and disciplined, helps you to plan and track your progress and identify areas that you require improvement. And it ensures responsibility and accountability, because when you have a target, your mindset is focused towards that target and you do everything that is necessary to ensure that you meet that target. That is the secret of academic targets. The secret of a learning schedule is also very important. And there are several benefits of a learning schedule. And studies have also shown that the learning schedule can also improve your academic success. It improves your productivity because you have a tendency to have assigned your activities for the week, for the month, or even for the year. It's also important because it improves your focus and concentration. It helps you to establish a consistent routine. You're able to prioritize tasks, and you can also schedule distractions. That's the secret of attending classes. This is also very, very important. When you attend classes, you achieve several benefits. The first is that you learn using multiple senses. And as we have said earlier in our discussion, when you learn with multiple senses, you have a tendency of making your long-term memory mature faster. And you learn with multiple senses because when you see your lecturer and lecturer speaks, you learn with your auditory learning method. When a lecturer writes on the whiteboard or uses a projector to teach you, you learn with your vision. You can also learn from other colleagues and what they say. You can directly learn from your lecturer. So you can also establish connections with your students, with other fellow students and tutors. Lecturers can give you cues of what is important. And it also gives you an opportunity to take notes, personal notes, direct notes, of course, because the lecturer has more experience and more knowledge about the topic. It improves understanding, gives you opportunity to ask questions, and then improves your knowledge. Studies have shown that poor class attendance is strongly associated with low grades. This is the secret of attending class. There's a secret of pre-reading before class. And this is also very, very, very important. And the idea is that when you read before class, and it's not about reading extensively, taking 5 minutes or 10 minutes of your time, just scan through the topic that is going to be discussed or taught in the classroom, has been shown to improve your learning process, your understanding, and of course, that pathway to pass an exam. It improves your focus and engagement because you have a preliminary knowledge of that topics. It improves your note-taking. It makes you familiar with the language that is being taught because it's not the first time you are being taught that. It improves your confidence and it makes asking questions. Usually students have difficulty asking questions during the lecture. But if you have read or you have a background information before, it makes asking questions easier. And it improves your understanding. This is the secret of pre-reading before class. The secret of spaced repetition. A number of studies have shown that spaced repetition, spaced learning has significant benefits in improving understanding, recall, and of course, the process of passing any examination. There are 2 groundbreaking studies that have shown this. Most of these studies were done by Ebbinghaus. Relates to the overcoming the forgetting curve. So the picture at the right depicts the curve and tells us how to overcome the forgetting curve. Usually, if you do a pre-reading, you start your knowledge base from 100%. But if there's no pre-reading, you start your knowledge base usually lower than 100%. What is recommended that if you want to overcome your forgetting, what you need to do is that you read, apart from reading before the class, you read immediately after the class. You read 24 hours after class, at least 1 week after, and at least 1 month after. And it says if you take this approach, you will notice that the tendency for you to forget will reduce to about 20%. And you'll be able to retain that information that you have for a longer period, for 1 month or more. because of repetition, and that's the process of overcoming the forgetting curve. There's also the principle of spaced learning, and this is an example of an experiment that was done amongst 3 students of different names. So the first student read for half an hour and rested for a few minutes and read for half an hour, but ultimately everybody read for 4 hours. Nora read for 4 hours straight without any rest period, and read for 4 hours but took intervals after every 1 hour. And the study found out that Leslie was more likely to do better than Anne and Nora. That Nora, of course, passed the exam, but got a grade of C. And this spaced repetition has been shown by several studies as a way in which we could improve the consolidation of our knowledge. So the brain requires some time to consolidate, to have a maturity of what you have learned. And so it is recommended that you don't read for a very long period. You read and take pulse intervals, spaced intervals, where you give your brain the opportunity to consolidate your memory to mature into a long-term memory. The secret of self-quizzes or self-testing. This is very important because the benefit includes it flags your knowledge gaps so that you can improve your weak areas. The secret of self-testing is very important because it helps you to retrieve information from your long-term memory. And as I said earlier on, when you retrieve information from your long-term memory, it creates more maturity. So the more you test yourself, the more you conduct more quizzes, the more mature your long-term memory is. And you also get accustomed to the test formats and it reduces your anxiety. It breaks up monotony because you're able to do so many things at the same time. It boosts your engagement. And of course, it reinforces both your retention and your speed of recall. The more self-quizzes you do, the more easily you are able to recall with speed. The secret of the discussion group. Discussion groups have several benefits. They help you to improve your understanding because you learn with multiple senses. You have diverse experiences from different of your peers that have different knowledge base. It improves your communication skills because you are given the opportunity to communicate in various ways. And it also improves your critical skill thinking and problem solving skills because you are questioned directly by your colleagues during the discussion group and you are asked probing questions that enables you to think critically and to solve problems. It improves your engagement and motivation. But discussion groups have to be dealt cautiously because there are several cons. If you have a discussion group that somebody is dominating or they have insecure students, it means there will be an imbalance in opportunity to learn, and one can easily get distracted. Of course, because discussion groups are groups that people have different opinions, so there's a tendency for conflict to arise. And what is advised is that don't join a discussion group that has people of the same level of intelligence or seriousness or mindset. You should be a mix so that you establish a balance. If you feel you are too hardworking or you are high intelligence and every other person in that discussion group is of low intelligence, you may not benefit much. A good discussion group is a group that has a mixture of everybody, people of high work ethic, high intelligence, low work ethic, low intelligence, so that mix will create an opportunity for everybody to learn. The secret of multisensory learning. This is very important and is self-explanatory from how our brain learns. Our brain learns with multiple senses. And as I've described earlier, but this information regarding the multisensory learning is based on research. A research done by Carl Spencer Lashley in the 1800s. And what he did was to teach mice or rats how to walk through a maze. And he wanted to find out what part of the brain stored our memory, our learning itself. And what he observed was that after teaching the rats how to walk through a maze, he cut off parts of their brain to see whether they still retain that ability. And to his amazement, this rat retained the ability to walk through the maze. And so what he hypothesized at that time is that we have different parts of our brain that are involved in learning, and we learn using multiple senses. So if you want to learn with your eyes, learn with your ears, learn with your touch, learn with stories, learn with emotions. So it improves our redundancy. It means you have information in different parts of your brain. It helps with reinforcement, and you use your whole brain to learn. It reduces your cognitive load and promotes dual coding. Of course, it improves your concentration and focus, and it develops critical thinking. That is the secret of multi-sensory learning. The secret of academic mentors and private tutors. Of course, in academic institutions, we are advised to get academic mentors, and of course, private tutors are also gotten for pupils, their parents, to teach them at home. The benefit of this is a personalized learning. Personalized learning is a learning approach that is tuned to you. We all have our different learning styles. People learn sometimes by what they read. Some people learn by what they see. Some people learn by what they hear. So we have different ways to learn, and some of us have learned with a combination of things. So personalized learning is able to adjust that learning process to fit your need, and gives you the ability to ask questions that are specific to you, because in a normal classroom setting, you are not able to ask those regular questions. It helps you to overcome learning obstacles. It helps you to navigate academic and professional paths. It improves your self-esteem. You'll be able to develop career goals. It improves the understanding, retention, and recall, and improve your study skills. A number of studies have shown that tutors and academic mentors are beneficial in your pathway to achieve academic success. This is the secret of academic mentors and private tutors. The secret of memory cues. This is very, very important. And there are several memory cues that are out there that will help students to learn better. The secret of mental representation. Mental representation is the ability for you to create an image of what you are learning. I'll give an example. As a lecturer, I teach medical students and young doctors. For instance, I teach a life cycle of malaria parasite, and I tell my students that if you want to remember anything, and you want to remember the life cycle of malaria parasite, create a mental image. Think about the mosquito flying. Think about the mosquito biting, passing through the bloodstream, going to the liver, multiplying the liver. Think about it going from the liver to the red blood cells, multiplying the red blood cells, and going back to the mosquito. Create a mental picture of what you're learning. If we're able to create a mental picture, a mental representation, it helps to mature our long-term memory, and we have a greater tendency to remember. And that is the secret of mental representation. There's also the secret of association with long-term memory. We have expended a lot of time putting a lot of information in our long-term memory, but we don't take advantage of it by associations or by linkages. If we're able to link a recent information with a long-term information, we can remember faster. I've given an example of the changeover switch here, which is a personal experience. In my house, I have a changeover switch, up and down. Up is for the national grid, the routine power supply. Down is for my generator supply. But intermittently, I get confused whether up is actually for my generator or down is for my national grid regular power supply. And in Nigeria, we have a famous phrase which says up NEPA. Up NEPA means that there is light from the national grid. And it just appeared to fall in tune to what I needed to learn. And so because I know up NEPA and my changeover switch reflects that anytime it is up, it is supplied from the national grid. To date, I don't forget the position of my changeover switch. And that's a way of associating information I need to learn with a long-term memory I've gotten over time. There's also the secret of chunking. I ask, memorize this, what you are seeing, in 5 seconds, or even in 10 seconds. 1, 2, 3, 4, 5. If you are able to memorize it, maybe 50% of people that have gone through this may be able to memorize and repeat what they see here. But you can improve your memorization and your ability to recall if you use chunking. You'll be surprised what you have here represents the symbol, the acronyms for some media stations in Nigeria. So TVC, NTA, AIT, and GoTV. M could stand for media. So chunking is a process of breaking into bits, because usually fast recalls are in the short-term memory. If you're able to chunk into smaller bits, you're able to recall faster. And chunking is very, very, very necessary in everything we do, in our ability to learn. If we chunk in information into smaller bits, it becomes easier for us, especially meaningful bits. And those meaningful bits must make meaning to you. when it makes meaning to you, it becomes easier for you to learn. Patterns. Patterns is another memory cue where we can learn. And in fact, artificial intelligence is based on patterns and algorithms. And we must always explore patterns to learn. And this, I give an example of several ways I have been able to use patterns to learn as a medical doctor and also to teach my students. Sometimes we ask students to give you list certain things. For instance, this is an example is to list the manifestation of severe malaria. And sometimes students have difficulty listing, giving a complete list. And for all you know, they only remember 3 out of 10 or out of 20. And what we have learned over time that is you can use patterns to remember. And what is peculiar about this manifestation of severe malaria and what I have learned is that using patterns is that there are 4 H. There's hypoxia, there's hypotension, there's hemoglobinuria, there's hypoglycemia, there's hyperparasitemia. What is also peculiar here is that these manifestations are organ specific. The brain, the lungs, the liver, the kidney. So you see pulmonary edema, you see kidney injury, you see jaundice. These manifestations are also clinical and laboratory. So you see hyperparasitemia, for instance, in laboratory. Hypoglycemia is laboratory. Frustration is clinical. So if you are able to create patterns from what you are learning, it gives you the ability to remember faster because those patterns are easier to recall than just reading to remember. That is the secret of memory cues patterns. Of course, landmarks, mnemonics, acronyms are very, very important. Using a landmark is finding something that perhaps in your long-term memory or something that is easy to remember, and you put it as a landmark to recollect everything you have learned over time. Last but not the least is the secret under memory cues, the secret of finding meaning. Finding meaning is very, very important. And finding meaning, which is relates to the secret of the first principle, is knowing exactly what the information you are trying to learn is about. Getting to the root of that information, finding meaning to information. So I give another example. For instance, I always ask my students, and it's asked in there several examples, what is the laboratory diagnosis of viral infection? And sometimes students struggle to remember the various ways in which we could diagnose viral infection in this every other pathogenic microorganism. And I say one of the ways to remember is to find meaning to what you are doing. So, and in finding meaning is to understand what a virus is. A virus is an intracellular pathogen that depends on cells to multiply and to live. A virus consists of nucleic acid, which can either be RNA or DNA. The virus is surrounded by a protein antigen. And of course, this antigen, when exposed to the human body, will develop antibodies. Viruses infect cells and they are within cells. So for you to make a diagnosis of a virus, first you need to detect the nucleic acid. And how do you detect the nucleic acid? You detect nucleic acid by polymerase chain reaction and by sequencing. You can also detect the antigen or antibody. How do you do that? You detect it by serology or rapid test. You can also detect the virus within cell, and you do that by immunohistochemistry or immunofluorescence. You can directly detect the virus using an electron microscope, and you can grow the virus or culture the virus. So if we find meaning to what we're doing, we're more likely to remember faster. And this is the secret of finding meaning. The secret of sleep and food. This is critically very, very important. And this is one of the factors that make people that are prepared very well and intelligent students to fail. Secret of sleep and food says that we require sleep because it improves our focus and concentration. As we have said earlier on, sleep is an important ingredient for you to consolidate your memory, to make your memory more mature. So it's recommended that each time you read, find time to sleep because sleep is important. Food is also important because food is a fuel to your brain. Food is the energy you require. Light breakfast before you go for an exam is very, very important because it also improves your focus and concentration and enables you to think widely and also remember widely. That is the secret of sleep and food. The secret of pre-examination planning, writing plan. The secret of pre-examination writing plan is also very important. Many people fail exams not because they have not read, but because they don't plan, they don't have writing skills. Pre-examination writing plan says that you should plan just before you start writing your exam. What is important? Read the instructions. You need to know what to answer first. And determining what to answer first is related to what you know and the time allocated and also the marking scheme. You also need to deliberately allocate time to each of the questions and also follow up with the time. What I do when I write the exam is to spend 5-6 minutes of my time writing a plan to what I'm going to do, how I'm going to answer each of the questions, because that's very important. The structure of what you want to write is important, because if you don't do that, you tend to lose out some information. And it's important to also recognize the marking scheme, because sometimes students write exams without considering the marking scheme. And when they say answer all questions, you're expected to answer all questions. And note that for a marking scheme has elements to it, has landmarks. You must recognize those landmarks and ensure you answer, provide information for each of those landmarks. So there are several benefits. Of course, good time management. It makes your writing more meaningful, more clear, and more complete. You focus on what is important. It helps you to follow instructions. And of course, ultimately, you have better grades. So what happened to Emmanuel? We talked about the story of Emmanuel. Emmanuel that has now passed through learning some of the secrets of passing an examination. And we said that he needed to change 3 things. So what are those 3 things? Here, about changing his intelligence by adopting memory cues, using patterns, using associations, using acronyms, finding meaning to what he's doing, and learning with all his senses, through stories, through emotions, and the likes. Emmanuel will change his study habits. Of course, he has to read before class. He has to attend lectures because it's of benefit to him. He has to adopt space learning. You learn for a while, you self-test, you self-quiz, you rest for a while, you learn for a while, and of course, you find time to sleep. Emmanuel also has to change his mindset. He's more confident in his abilities. He strongly desires to achieve academic success, and he's looking for inspiration to do that. He has an academic target. He wants to do very well. Because Emmanuel has changed his mindset, Emmanuel has changed his intelligence, Emmanuel has changed his habit. He has done very well, and he's celebrating that he has passed his examination. He has done so well that the university has recommended that he be transferred to medical school. Emmanuel is now in medical school with new challenges, the bulk of knowledge he needs to acquire, the practical skills that he requires. It's a point for him to get some tips on how to sail through medical school as a medical student or even as a young doctor. So I want to give us some few tips for medical students and young doctors that are preparing for exams and currently or in the future. Tip 1 is respect your jota. I think the jota is very, very important in a medical career, because in medicine you learn through various means, and there's a lot of information for you to learn. A lot of textbooks, a lot of teachers, a lot of patients, and each of them are sources of information to learn. And so the jota is not for you to do copy and paste when you are giving lectures. It's for you to emphasize important points. Keep records of important points. These important points will come during your lectures, while you are with the patient, while you are with your senior colleagues, or while you are with your colleagues. It helps you to clarify and paraphrase confusing points, and it creates a condensed record for your study. Every student in a medical career, or even a health-related career, should have a medical jota where you document everything you have learned, and it's an opportunity to expand your knowledge and accelerate the process for you to pass your examination. That's tip 1. Tip 2 is learn around your patient. This is critically important. Learning around your patient has several benefits because it replicates so many things about how the brain learns. Medicine is an apprenticeship. The first benefit of learning around your patient is that it makes you to find meaning in what you are doing. You find meaning in a disease, in a symptom, in a sign, in a treatment, because you have seen a patient. And when you find meaning and relate it to a patient, you remember better. It creates a good, real mental representation. The best way you can have a mental representation about a disease is through your patient, and it helps you to consolidate your knowledge. I've developed the habit right from medical school that every patient I see, I take 5 to 10 minutes, sometimes 10 minutes, 30 minutes to read around that patient. Some of the knowledge I have now as a consultant, the infectious disease consultant, broad knowledge of medicine, even outside my field, is related to how I learned around my patient. And I still have a mental picture of some of my patients, even from my time of housemanship to date. And that's the importance of learning around your patient. Of course, it enhances your practical skills, because the more you learn around your patient, the more practical you are about what knowledge you need to learn, the practical skills you need to learn to be a better doctor or health practitioner. That is tip 2, learn around your patient. Tip 3 is clinical skill drills and more clinical skill drills. This is equally very, very important, because medicine is about physical, mental, and a combination of skills. Clinical drills help you to sharpen your practical skills. And I always tell my students that don't wait for the exam to show your weaknesses. Expose yourself through practical clinical drills that are self-driven, peer-driven, or tutor-driven. In fact, somebody has done a study where they found out that for the West African College of Physicians and the National Postgraduate Medical College, centers that have students that pass their exams more frequently, the residency training, are centers that do more drills of their students. They simulate the exam condition. And so as such, students have more confidence, and they have exposure to diverse insights and experiences. They put themselves in an examination environment. They are more likely to learn. So if you want to pass the clinical exam, do more drills, drill yourself, be exposed to drilling. And that's a secret I've applied even throughout my medical career. I always have take the opportunity to present cases, to learn from my seniors, to learn from my peers. That's the secret. There's a tip related to clinical drills and more clinical drills. Tip 4, common things occur commonly, including past questions. This is very, very important. And we tend to neglect this, even in our medical career. Note that the experience we have as teachers, and experience I've had teaching medical students and young doctors over the years, is that you're more likely to fail if you don't know common things. If you don't know the big stuff, the rare things, you are unlikely to fail. It's good if you want to be a good student, but you should focus on common things. And note that because medicine is conservative, so not so many things have changed over the years. It takes a lot for medicine to change, because evidence is not really readily acceptable until it is tested, and that testing period takes a lot of time. So ultimately, many of questions that have been asked in the past will be repeated. And in some studies have shown that 50%, 90% of examination questions are actually repeated. So it's very important that you have access to past questions, either from your seniors, from your teachers, or from the institution. Past questions put you in a real situation of how your exams will appear. That makes it easier for you to pass your examination. And there are several studies that have been shown that walking through past questions, reading what is common, can help you to pass your clinical examination. So what is Emmanuel's feature? Emmanuel has gone through this process of learning how to pass exams. Emmanuel has received tips on how he can go through his journey as a medical student and even as a young doctor. Fortunately, he's an emerging physician scientist, and he still has a lot to learn. I want to conclude with 2 major slides that talks about what the major reasons people fail exams. People fail exams because of negative mindsets. If you believe that you will not pass, some people have already resolved in their mind that there are certain subjects that they will fail. If they believe they will not pass, they will not pass. Negative mindset is one of the reasons people fail exam. Lack of preparation and procrastination, which is common and usually affects everybody, because we have a tendency to leave it to later. We have a tendency to delay. And when we delay, we have 1 week, 2 weeks to the exam. Before we know, we are cramming. We have a lot of work to do. But if we can take the time to prepare early, preparing early is read a little just before your class, read a little just after your class, read intermittently during the week, during the month. When you do it that way, when you're close to the exam, majority of the memory you have will have consolidated, will be mature, and it will be easy for you to retrieve and easy for you to pass your exams. Poor examination technique is also a common cause of failure on the exam, misinterpreting questions. So sometimes people don't completely read a question, and that's why it's very important for you to take at least 5 minutes of your time to plan your examination before you start writing. And interpret the question properly. There are a number of people that have misinterpreted questions, have written something different from what they are asked, and on account of that, they have failed the exam, not because they're not intelligent. And most do not articulate their answers very well. The answers are not complete because they did not read the question very well, or did not use landmarks, or did not follow the marking scheme. The marking scheme is very, very important, and the marking scheme gives you an idea of how you'll be scored. Sometimes students fail not because they don't have knowledge, but because they don't know the marking scheme and the answers are not complete. Time is management is very, very common cause. And I get examples of students that have failed exams because not because they don't have knowledge, but because they didn't manage their time. They say, I didn't have time to complete. I only did 2 out of 5 questions. And that's because they mismanaged their time and they spent so much time writing in an area they know, not knowing that they needed to manage time and allocate time to each of the questions so that they could complete the questions. Dependence on examination malpractice is also a significant challenge that we face in all parts of the world. Fortunately, many students are so dependent on examination malpractice, and when they get to the exam, it's no longer available and they fail the exams. Concentration issue is also a challenge, and that will be related to cramming, procrastination, not taking a light breakfast before the exams, or not sleeping properly. And that makes it difficult for you to recall and retrieve information from long-term memory. Text anxiety is also important, and you are able to reduce this if you are more prepared. If you are more confident about what you are doing, and you are able to have done a lot of self-testing and self-quizzes, your test anxiety will reduce. Of course, emotional instability is a common cause of failure in examination. No matter how intelligent you are, no matter how well you are prepared, if you are emotionally unstable before your examination, or you are emotionally unstable, it becomes very difficult for you to learn. And there are several causes of emotional instability, and it could be parental factor, it could be personal factor, it could be institutional factor. And it's important that you take care of your emotions if you really want to pass any examination. So, what is the best consolidated secret for passing an examination? Having gone through the evidence of how the brain learns and all the secrets and all the tips, my view is that we will need to exploit how the brain learns and overcome the forgetting curve. And my best consolidated secret for passing an examination is self-practice and tested spaced repetitions using multiple senses. And to break it down, it says that when you want to learn, ensure you learn in repeated intervals. Your learning process should be in such a manner that you have the opportunity to test yourself, especially in a practical way. Practice it and test yourself and learn with all your senses and not just one senses. That is the principle of self-practice and tested spaced repetitions using multiple senses. So having said this, I am very confident that having gone through this lecture, your success in your examination is guaranteed. Thank you for listening.